Welcome to Dr. 7. Today, we're looking at what happens when you stick your arm out to catch a fall. The force of that impact travels straight up your arm and into your shoulder. Most of the time, the first structure to fail under that sudden pressure is the clavicle, widely known as the collarbone. It simply snaps. Breaking a collarbone is incredibly common, but that frequency masks a geographic danger. This bone sits just millimeters above a major thoroughfare of vital nerves and massive blood vessels routing directly from your chest to your arm. Because of this tight clearance, a jagged bone fragment in this exact spot can puncture the subclavian artery, causing a fatal hemorrhage. Or it can trigger a blood clot in the subclavian vein, which can travel to the lungs as a pulmonary embolism. This raises a serious anatomical question. Why rely on a bone that breaks so easily to absorb these impacts? To understand that vulnerability, we have to look at the mechanical blueprint of the shoulder itself. The upper limb connects to the rest of your body through the pectoral or shoulder girdle. It is a surprisingly minimalist system, relying on just two bones, the clavicle in the front and the scapula in the back. If we look at the back, the scapula or shoulder blade functions as a highly mobile floating anchor plate for the massive muscles of the arm and torso. Across its posterior surface runs a triangular ridge called the spine of the scapula. This ridge divides the upper and lower sections of the bone, providing a robust attachment point where the heavy trapezius and deltoid muscles lock in. As that ridge traces laterally toward the outside of the shoulder, it widens into a structure called the acromion. This specific tip forms the physical joint where the scapula meets the collarbone. Tucked in the front is another projection, the hook-like coracoid process. It acts as a dense junction box, anchoring an intricate web of stabilizing ligaments and arm muscles, including the short head of the biceps brachii. Yet, despite the massive weight of these muscles and the dense ligament webs pulling on the shoulder blade, it does not directly attach to the main skeleton. The entire physical load of the arm hangs on a single bridge. That bridge is the clavicle. It acts as a solitary, rigid strut connecting this entire floating shoulder apparatus to your sternum. Biologically, this bone carries a bizarre developmental paradox. In a human fetus, the collarbone is the very first bone to begin the ossification process and start turning into hard bone. This chart shows how it forms differently than any other long bone in the body. Instead of replacing a cartilage model over time, it ossifies intramembranously, developing directly from a specific embryonic tissue called the somatic lateral plate mesoderm. But despite starting first, it is the absolute last bone to finish. The clavicle takes approximately 21 years of human life to fully mature and complete its ossification. You have a bone that undergoes a 2-decade maturation process, yet it is tasked with serving as an isolated, rigid shock absorber for the arm. When sudden trauma hits, this combination of forces turns the collarbone into the body's ultimate structural fail point. When you hit the ground, the force of the fall compresses that single strut. The bone almost always buckles at a highly specific location, the exact junction where its middle and lateral thirds meet. The moment it snaps, the carefully balanced tension of the shoulder girdle fails. The powerful muscles attached to the bone instantly yank the freshly broken fragments in opposite directions. The neck muscles pull the inner proximal fragment sharply upward. Meanwhile, the arm's dead weight drags the outer distal fragment downward. Sitting directly beneath that dropping fragment is the lower trunk of the brachial plexus nerve cluster, the subclavian artery and subclavian vein. The downward displacement of the jagged bone edge acts like a blunt guillotine pressing into these delicate vessels. This specific mechanical failure is the exact mechanism that triggers a fatal bleed or a deadly thrombosis. And this structural vulnerability exists from day one. In childbirth, babies delivered in a breech presentation often suffer this exact same downward displacing fracture as they are pulled through the birth canal. The design of the human shoulder girdle is an evolutionary trade-off. We gain an unparalleled range of motion, allowing us to throw, climb, and reach. But the cost of that mobility is relying entirely on a single, slow-developing, and highly vulnerable bone to hold it all together.